Okay, good morning, ladies and gentlemen. I hope we are 1 hour shorter than yesterday. Your breakfast coffee was strong enough. Thank you, Dr. Probst, for inviting me to this conference, and I'm happy to be here with you all. Okay. Yeah. So for all of you who don't know me, let me introduce myself. My name is Christiane Herzog. I'm the Deputy Director of Arnica Pharmacy. And Arnica Pharmacy is specialized in micronutritions for parenteral and oral use. And today I want to give you a short presentation about amino acids and vitamin C and cancer therapy. And so let me give you a short overview of the following contents. We will start with a short introduction. I learned something about the hypothesis according to Professor Thalberg, see how active ingredients can influence cancer cells and also reduce side effects of chemotherapy or radiotherapy. And at the end of the presentation, I want to give you an example of a possible infusion you can do. Let me begin quoting Professor Linus Pauling. He received the Nobel Prize in elucidation of the structures of complex substances, like the chemical bonding of micronutrients, and he said, "Orthomolecular medicine is the maintenance of good health and the treatment of disease by altering the concentration of substances in the human body that are normally present in the body and necessary for health." So what does he meant by body's own substances? These are the micronutrients, like amino acids, fatty acids, minerals, trace elements, vitamins, pre- or probiotics, or phytochemicals. And one person researched a lot with micronutrients, and this was Professor Thalberg. And he coined the sentence, "The essential therapeutic momentum must be the recovery of mitochondrial activity." So he was a very famous tumor biologist and did over 30 years of research on bioimmunotherapy at Helsinki University Hospital. And his main topic was the recovery of dysfunctional mitochondria back to effective ones. Because in his opinion, mitochondria play not only a role in production of ATP, but also in the control of the genome in the nucleus. And so his hypothesis was that transformed mitochondria seem to signal the nucleus to induce oncogene transcription back into normal, healthy transcription. So how did he do this? He did a lot of animal studies to find the cell-regulating components. And as he identified the cell-regulating substances, like amino acids, he did clinical studies to verify the animal experiments. So I brought you a table on this slide where you can see an overview of different cancer types, and also the amino acids Professor Thalberg identified as a cell-regulating component to change the mitochondrial activity. And you can also see that he found 4 amino acids in nearly all types of cancer. And these are alanine, glutamine, glycine, and lysine. And some special cancer types have more typical amino acids to regulate the cells. So what can you do with this information? You can do infusions with these amino acids, but you also can prescribe individual powder mixtures with amino acids. And the dosage is 5 grams per amino acid per day. So there's one thing you should note. If you do a dosage over 15 grams per amino acid, per day, then you can, or there may occur imbalances in amino acid metabolism, because the body's own transporter can't differentiate between the single amino acids. And if there's one very present in volume, it will statistically pick up this one more likely. So it's no surprise, Professor Thalberg said, amino acids are the base of our life. So I want to give you some information about the single amino acids. We will start with L-alanine. This is, on the one hand side, a cell regulation substance according to Professor Thalberg, but on the other hand, it is very, very responsible for the regulation of the blood sugar level, and it's important to transport ammonia to the liver cells to detoxificate ammonia. You know, ammonia is a very toxic substance for the cells, and if the detoxification doesn't work, it can, at the very end, at least induce cancer. So you can dosage L-alanine orally 1 to 5 grams per day, or you can also use it as an infusion, but only together with L-glutamine as a dipeptide, because L-alanine is not stable in water alone. So we follow with glutamine. It's also an cell-regulating substance according to Professor Thalberg, but it's also responsible to regenerate mucosa cells, to stabilize the blood glucose level, and it's anti-inflammatory and anti-ulcerogenic. It plays also an important role in the intestine-associated immune system. It can induce a faster reaction time and antibody production. It proliferates the T lymphocytes and NK cells. It activates the macrophages, and it is a precursor of glutathione, so it's also an important amino acid for detoxification. So here you would dosage it orally 5 to 10 grams per day, or intravenous as a dipeptide L-alanine L-glutamine. There you have to be aware there exists some contraindications, because L-glutamine can be changed in the body to glutamate. So if you have got patients with bipolar depression, the manic phase can be increased, or you can induce an epilepsy if you go higher than 2 grams per day. And you can't use it if the patients have severe liver diseases. So this is the dipeptide, L-alanine, L-glutamine. That's important to get a substance for the intravenous dosage. You have the same contraindications because there is L-glutamine in it. So that's clear. Okay, we will follow with glycine. It's the smallest amino acid we know, but it's very important for the body because it can, on the one hand side, increase the expression of antibodies and T-cell proliferation, but it's also, like glutamine, a precursor of glutathione. So it's important for the detoxification and the liver regeneration. But it is also an inhibitory neurotransmitter, so it's anticonvulsant and relaxant. You would dosage it like 1 to 5 grams per day orally, or intravenous you can use 1 to 2 grams as a short infusion or as an injection. There is one interaction you should be aware of. It may increase the effect of neuroleptics if the patients use haloperidol-related substances, because it's an inhibitory neurotransmitter. So lysine is one of my famous amino acids. It's not only a cell-regulating substance, according to Professor Thalberg, it's also very important in virus defense, because viruses grow with L-arginine as a very important factor, and L-lysine is an antagonist to L-arginine. It's structural very similar, but not the same. So the viruses, especially of the herpes subtype, falsely incorporate L-lysine into the DNA structures. So the virus growth stops. And that's an information you could also use with post-COVID patients. As you surely know, SARS-CoV-2 can induce the virus growth in infected cells to reactivate them. And with L-lysine, you have a powerful amino acid to stop this growth. So you would dosage it 5 grams per day, orally or as an infusion with 2 to 4 grams. So this is not really an amino acid, L-glutathione, it's a 3-peptide. But it's very important for cancer patients because nearly 80% of the cancer patients have a deficiency in L-glutathione. And it's very important for the mitochondria because it just does a protection against oxidative damage. And it's a very important antioxidant for the body. It can detoxificate heavy metals, plays a role in the liver detox phase 1 and 2, and it can modulate the inflammation. And by the way, it regenerates vitamin C, E, and the carotenoids. So as orally dosage, you would use S-acetyl L-glutathione, or intravenous L-glutathione, or also acetylglutathione. Taurine is also not really an amino acid, but it's very important. You can see it has got a sulfur in it. So it's also an antioxidant and can detoxificate heavy metals. It activates phagocytes and increases the release of interleukins, and it is also an antioxidant for the mitochondria, and it is very cardioprotective. You can dosage it orally 1 to 5 grams per day, or intravenous 1 to 2 grams. So carnitine is also an important amino acid-like substance. It's important for the body's own energy and fat metabolism. It's an antioxidant, but the most important information is that it is neuroprotective and against fatigue. So you would also dosage it 1 to 5 grams per day, or intravenous 1 to 2 grams as injection or short infusion. And now I want to give you an overview about how we can reduce side effects of chemotherapy or radiotherapy. And Uwe Gröber coined the sentence, "The aim of complementary medicine measures is primarily to reduce therapy and disease-associated side effects." I want to show you this study. It's a multi-center, double-blinded study with breast cancer patients. And you can see it was we measured the influence of vitamin C infusion once a week with 7.5 grams vitamin C. And nearly all common side effects of chemotherapy could be decreased. So L-carnitine, we have heard nearly 80% of cancer patients are deficient in L-carnitine. And the bad news are that cisplatin, ephosphate, and taxanes inhibit the renal reabsorption of L-carnitine and also increase the L-carnitine excretion by a factor of 10. So the deficiency in the patients will go on and go on. And these chemotherapeutics are very nephrotoxic, and ifosfamide is very mitochondrial toxic. And the typical side effects are fatigue, malnutrition, and depression. And L-carnitine has got a pro-apoptotic effect on tumor cells. It can stabilize the membrane in the mitochondria. It reduces the nephrotoxicity, the cardiotoxicity, the mitochondrial toxicity, and also the cachexy. And there is one very important information. You should do the infusion 1 hour directly before the chemotherapy starts. 1 to 2 grams as a short infusion. At least once per week. So if you have weeks without chemotherapy, you should also do the infusion with L-carnitine. And here is a study with cancer patients, with pancreatic cancer patients. It's also a prospective multi-center placebo-controlled randomized and double-blinded trial. And you can see just orally given L-carnitine 4 grams per day over 12 weeks increase the BMI, the BCM, and the body fat and longest survival rate. So L-glutathione is very important to go against the neurotoxic effect from cisplatin. So you can use it 15 minutes before the chemotherapy starts, and you will dose it at 1,500 milligram glutathione per square meter of the patient. And then you can use on the 2nd and 5th day after chemotherapy 600 milligram intramuscular. And at the end, I want to present you an example of a possible infusion. You can use once a week. So at the first ingredient, you would use vitamin C, 7.5 gram. So we can use the reduction of side effects with vitamin C. Then we will have the 4 active ingredients according to Professor Taubeck, with alanine, glutamine, lysine, and glycine. We can use L-carnitine to reduce the toxic side effects of chemotherapy and to increase or to work against the cachexy. And we can use taurine as a cardioprotective substance and also as an antioxidant for the mitochondria. And these all you can mix in a carrier solution, 250 milliliters, and you can use L-glutathione directly before or after the infusion as an injection. Okay. Thank you very much for your attention.
Es gibt keine Patienten, es gibt keine Therapeuten, es gibt nur Menschen.